Welcome everybody to today's webinar hosted by Jennings, a healthcare marketing and audience engagement firm, and Hive Strategies, a firm that helps health systems create HIPAA-compliant online communities for better patient engagement. I'm Dan Hinman, and I'm a principal at Hive Strategies, but today's webinar will feature Dan Dunlop, a principal at Jennings. Dan will present a vision of healthcare marketing as online community building. So Dan will speak for about 50 minutes, and then we'll have 10 minutes for your questions at the end. I'm really excited today about Dan's presentation. He and I have been friends now for a few years, and I've heard him speak at various conferences. He's smart and friendly, and you'll find that his presentation is packed full of useful advice. So a little bit more background about Dan. He's a healthcare marketer, innovator, brand consultant, blogger, author, and sought-after speaker. He's a thought leader in the field of healthcare marketing and is perhaps best known for his work related to the roles of social media and online patient support communities in healthcare. I love hearing Dan speak because he speaks with conviction when he tells clients and audiences that within this new healthcare ecosystem, marketing professionals must become community builders, facilitators and managers, rather than just content developers and distributors. Dan serves on the editorial boards of Healthcare Marketing Advisor and eHealthcare Strategy and Trends, and he's also a contributor to Reagan's Healthcare Marketing and Communication News. So today, Dan's goal is to give you lots of information that you can actually use, so you'll leave this presentation with a community building mindset, so you can be even better marketers. Here's Dan.
Thanks, Dan. That's a heck of an introduction. I really appreciate it, and it's nice to have somebody who knows me so well introduce me. And I promise I'll do a better job when I introduce you for your next webinar. But and that brings up a point. This is part of a series of webinars that Dan Hinman and I are doing, our two organizations are doing together to introduce this shared vision that we have for where we see healthcare marketing going, and certainly where we'd like to see it go. We're not there yet, and I'll talk about that to some degree today. But anyway, it's a pleasure to be here with all of you, and in particular to be sharing this stage with Dan Hinman, who's a wonderful guy, and I have such high regard for his work and his organization. So Dan did a nice job of setting up this idea, this vision of healthcare marketing as community building. I think we would all be better marketers if we went to work every day thinking that we are there to build community, and specifically build community online. And the truth is, most healthcare marketers are not approaching their jobs that way. What we do today is spew content at consumers. It's been my experience over 20 years working in this industry, and it has not changed significantly. In fact, even the innovation and the addition of new tools like social media platforms and blogs and online communities hasn't really changed that. One of my pet peeves is that we've taken these wonderful tools like Twitter and Facebook and LinkedIn and all the others. I mean, there's tons of them. But we've taken these tools, which are unbelievable opportunities to be engaged in conversations with consumers, to listen to consumers. And instead of doing those things, we're just using them to spew content at consumers in the same way we used radio and television and print ads in the past. So the fact that these tools have these capabilities hasn't changed the way we use them. And I think if you look at those tools and say, I want to be a community builder, it dramatically changes the way you use them. It changes the way you use your website. And it might even change the way you do print and radio advertising for that matter. So with that said, I'm going to launch into this presentation. So the truth is the world has changed. Marketing has changed. Healthcare is changing dramatically. And the way we communicate with patients, prospective patients, and physicians, and I add physicians because I know they're an important audience for most of us. So the way we communicate with them needs to change as well. And frankly, it hasn't yet changed. Just to demonstrate how much the world has changed, this was a real simple and Huffington Post survey that took place almost a year ago probably 13 months ago. And it was all about women in North America and their use of smartphones. And this was a way of showing, hey, we really have changed. Women, how often do you check your smartphone? 39% do it every hour. And you can see the other numbers. And they're not checking it to check email. They're checking Instagram. They're checking Facebook. They're checking Pinterest and so on. They're texting. They're responding to texts. Now look at this. Where do you typically keep your smartphone while you're sleeping? Only 31% have it in a room other than the bedroom. The remainder have it either in their bedroom or on their bedstand, or 5% in the bed with them. And when I talk to people about the use of social media, I tell them you can't think about social media as a 9 to 5 thing. Just because you're at the office from 8:30 in the morning or 9 in the morning till 5 in the afternoon, that doesn't mean people use social media that way. A busy mom, has that phone right on her nightstand probably. And first thing she does in the morning is check Facebook and see what people have posted and see the comments she's received on her post. Physicians, how do they check social media? They're checking social media between 5:30 and 6:30 in the morning and then late in the evening. Moms check social media again in the evening when the kids go to bed. So I think it's really important to understand the way these people are using social media, but clearly the world has changed. They asked these same women, would you rather go a month without your smartphone or a month without sex? 48% said they'd rather go a month without sex. I mean, this is amazing stuff. And overall, how has social media affected your relationships? 39% said it hasn't really impacted them. 24% are now closer. 17%, it allows them to interact all the time, and so on. So there are a lot of positives. Only 13% said we talk less, actually. And that's because you know what they're up to without having to talk. So we're in this era of the connected consumer, and that should not surprise you. Truly, the broadcast era, that old era that I grew up in, is over. We can't simply buy people's attention with advertising. Spewing content at them is not a solution anymore. The consumer is in the driver's seat today. Think about it. They control what they watch, when they watch it, and where they watch it, and on what kind of device they watch it. So it's not unusual that, for just as an example, my wife, my daughter, and I will be sitting in the living room in the evening, although it's not as common as it used to be, because now my daughter doesn't want anything to do with us and she's up in her bedroom on social media. But if all three of us are in the living room at one time, we have at least 7 devices going. There's a television on in the background. At least 2 of us have laptops. 2 of us are using cell phones at a minimum. I mean, it's just, there are constantly multiple devices going on. My wife last night and I were watching Sons of Liberty on History Channel, which is a great, great series. And I looked at my wife because she was on her laptop at the same time, and she was going through the Sons of Liberty website as she was watching the show on TV. This is the new reality. So with people on so many different devices, it becomes all that much more challenging to truly engage them and reel them in and capture their attention. So we have to be much more thoughtful in the way we do that. And I think by building community, by forming connections with them, and I'm going to define community building much more as we go along, but by building those connections, those shared interests, we have a chance of engaging them and slowing them down and getting them to actually engage in conversations with us. When using social media, women felt connected, entertained, informed. Some were bored, overwhelmed, inspired, relaxed. Several of these are the value that people find in this engagement. And one of the things I really want us as healthcare marketers to focus on is value. What value are we bringing to the relationship? I mean, I always try to think of the consumer with the word "so what" stamped on her forehead. I'm spewing content at her and she's saying, so what? Why do I care? Why is that important to me? How is that improving my life? Is it making me feel connected? Is it helping entertain me? Is it informing me? And I will tell you, with patients and prospective patients and family members, information is a really important currency, but it needs to feel credible and authentic and not prepackaged and feel like marketing. So the world we live in has changed. You know, we just looked at women's use of cell phones and digital devices. patients are turning to online communities in droves to get information or to find camaraderie, to find community. Patients like me, if you're not familiar with patients like me, they have 1,500 niche communities organized by the disease or the condition, whether it's diabetes or heart disease or specific types of heart disease. 300,000 people belong to these communities. It's an amazing phenomenon, and they're one entity. There are so many of these out there. Inspire.com, that I know several of the people who work at Inspire, they've got 425,000 members. 80,000 of those people participate in these rare disease communities. And if you think about it, these online communities are so important for people with rare diseases because you could live in a state where maybe only 4 or 5 other people have that particular ailment or are dealing with that rare disease. But if you go online and go into one of these communities, suddenly you can meet 500 other people who are dealing with it and learn about how they dealt with their diagnosis, what kind of treatment they've sought, how they reacted to the medications, what physicians are leaders in that field. So it's a really important tool, not just for the average patient, but for the rare disease patient in particular. The scleroderma community on Inspire.com has 13,000 members, and it's already had 50,000 plus posts. That's people having conversations. I mean, when people come to these communities, they are sharing, they're talking. It's really an amazing opportunity. It's so empowering for them. I led a patient panel at the New England Society for Healthcare Communications conference last May. I had several patients on the panel, and they talked about just how empowering it is to be able to meet other people like you who are dealing with the same things you're dealing with, and to have that kind of authentic, incredible source of information, and the support that comes with a whole community of people who are experiencing what you're experiencing. And the more focused the community can be on a specific disease or illness, the more powerful it can become. And physicians are joining these online communities as well. They're looking for places where they can meet with other physicians and talk about really complicated cases and get advice from their colleagues and do it in a private setting. Doximity is really, as far as I'm concerned, it's the really hot physician community right now. A lot of my friends who are physicians are involved in Doximity. I mean, over half of all U.S. physicians right now belong to Doximity. Sermo has about 300,000 members. Medscape, which is WebMD's physician-only community, has 170,000. So you can see physicians, I mean, don't let people tell you that physicians are not interested in social media or online communities. They're very interested. If you think about a physician's life today, their lives are very fragmented. They're running. They're trying to see 30 to 50 patients a day, and they want to have a life outside of that with their family. So they don't have as much time as they used to have for networking with other physicians, for meeting physicians after work for a cocktail or whatever they used to do, meeting in the doctor's lounge. So one way they are connecting and feeling that sense of connectedness, and we all like having that sense of connectedness, is by going to these online communities and interacting with colleagues. And the sub-communities within these, whether it's Doximity or Sermo, are based on specialty. So if you're a OBGYN or a radiation oncologist or whatever it happens to be, you can interact with those other physicians who share your interest in that specialty. So it's a really powerful phenomenon. And a lot of the marketing we've been doing to physicians, to referring physicians now, really relies on integrating digital communication to those physicians as well as the traditional forms of communication. So I'm putting forth this idea of marketing as community building. I want us to move from marketing to women or at women, where we're just spewing content in their direction, to marketing with them, to trying to build communities for them and with them. We need to make this investment. It needs to feel authentic. And these communities have so much power that typically the kind of information we produce as healthcare organizations doesn't have. We need to inspire them and enable them to become your best marketers and storytellers. If you create online platforms where people can come together, gather great information, meet others who have the same experience, If I have some rare disease and Hospital X creates this environment where I can go meet other patients, share stories with them, learn from them, tell my own story, and learn about treatments and what some of the side effects are and so on. Suddenly, I have a loyalty to that hospital who's made that happen. And then people start on that community, people start telling positive stories about their experience with your hospital. And they become that authentic marketer that you need. That's today's word of mouth marketing, whether it's happening on Facebook or Twitter or on a true patient support online community. Above all, it's that thing about value again, stamped on their forehead is what's in this for me. So we need to provide value to them. And yes, the information that we've been spewing, there is some value in that, in some of it. Frankly, I think a lot of our advertising in healthcare, there's very little value in, where we say we're number one in this and we're number one in that. We just really confuse consumers because everybody claims to be number one in something. So how in our communication and in our marketing are we enriching that individual's life? What value are we bringing to her? A sense of belonging certainly could be that. Provide a community. If I'm interested in weight loss or weight loss surgery, bariatric surgery, if I can come to a community where I can meet other people who've been through it, who are considering it, I can watch videos of your physicians talking about bariatric surgery, I can meet the nutritionist that you work with and the exercise people and learn about the holistic nature of the program. That's of value to me far more than you spewing ads at me or sending me a brochure or a direct mail piece. So what does value look like? It can be an emotional connection. It can be certainly information for patients. Convenience is of value. Give me easy access to the information I need. Entertainment. That's why so many viral videos or so many of the videos that go viral are entertaining because people want to be entertained. A sense of belonging is huge. I mean, when people are designing websites, I always say, you want to have a website where people land on it and say, okay, they were expecting me. That's why I'm here. They knew I'd come. And with hospital websites, you usually have the physician area or for healthcare professionals. Well, I want the physician who lands on that page, I want him to say or her to say, okay, they were expecting me to make a referral and look at all the things they've thought through. They really did anticipate me. This is the page for me. That's powerful. And patients want an opportunity for self-expression. I mean, we all do. We want to be heard and we want to share our stories. All of these should be present within communities that you build, whether that's Facebook or Twitter or LinkedIn or a true online community. I love this quote from Toby Bloomberg. As long as women feel safe in a community, they will feel free to express their personal viewpoints, which adds authenticity and attracts other women like them, increasing a community's value. It's just so powerful. I think our number one job with these communities is to create something that's inviting and welcoming. And we all know how to do that because we're human beings. We know how to be gracious and welcoming. So this is not something alien. This is not complicated. This isn't something I need an MBA to be able to do. But some of the values within communities are reciprocity. You know how if you have a friend and every time you meet with them, all they do is talk about themselves and they don't ever listen to you and ask what's going on in your life? That doesn't feel good. That's the same way it is through social media and through online communities. If all you're doing as the hospital partner is talking and not listening or responding or engaging, you're not very interesting. And that's why I think in social media, so let's say you're doing Twitter, I think 60% of your tweets shouldn't be about you. They should be retweets of other people's information. They should be links to other resources that you think are interesting and valuable, links to interesting news stories. Don't always be talking about yourself. Talking about yourself is not interesting. People are looking for shared values and interests. We naturally bond with people where there's commonality. When you meet somebody new, you immediately start fishing for what are the commonalities? What do I have in common with this person? I've got a coworker, Mike, and Mike and I both love craft beer. Now, Mike loves craft beer a lot more than I do, or at least he's much more knowledgeable than I am. But that is a commonality that immediately gives us something to talk about. When we first met, that gave us an entree to find out other things about each other. So we look for those shared interests and commonalities, valuing the opinions of others. It's not enough just to listen. You need to acknowledge that you've heard what they said and you value what they have to say, and you act appropriately. It's really tough in social media and in these online communities because you have to be vigilant. When somebody asks a question or makes a comment, you need to respond and let them know that they've been heard. And you are so appreciative that they would put themselves out there and offer up this information. Definitely, they're looking for support, either emotional and informational support. Kindness and civility, I think those should be two driving principles on any online community, social media platform. You want to be kind, even if the person on the other end isn't being kind and civil. You want to maintain a level of kindness and civility. And then you want those people to feel valued and appreciated. And what are these online communities and environments? Well, I'll tell you, your website is one of them. Your website can be an environment that is hospitable and inviting and welcoming. And we'll talk a little bit about how to do that. But certainly you can build in tools that help make that happen. But blogs, I love blogs for community building because blogs are better when they're more focused. A parent's blog isn't as effective as a mom's blog or a dad's blog, which dad's blogs are quite a trend these days. Social networking platforms like Facebook, Pinterest, LinkedIn. I love LinkedIn groups. I think LinkedIn groups are one of the most underappreciated things out there for bringing people together and facilitating conversations. I mean, that's what they're there for. Facebook, you can have private groups. I know hospitals that use them very effectively to bring together cancer patients, bariatric patients, you name it. There are the true online patient support communities put on by people like Inspire, Everyday Health, patients like me, I mentioned earlier. So those are some ideas of what these online communities are like. And you can build your online communities too. You don't need an Inspire or patients like me. You can use a service like Ning or a Facebook group and build your own online community, or you can hire a company like Dan Hinman's Hive Strategies, and they have an online platform that they will build the community for you. I would say my advice in building online communities is don't charge into this blindly. It takes a lot of work to maintain a successful online patient support community. It takes cross-marketing within the organization. I mean, it is a big deal. Too many people in this day and age I see starting these communities because the technology's out there. You can use an existing platform, but 9 out of 10 times these communities fail because it takes so much work to build momentum and to keep these members of the community engaged. Online communities for women, if you're not online looking at these, I highly recommend it. Health is a huge topic for women on the internet. Look at all these different groups that are talking about health, Disruptive Women in Healthcare, the Go Red group, Speaking of Women's Health, Academy of Women's Health, Empower. It's amazing. Health is a huge topic. I mean, we are in the sweet spot, and we just need to take advantage of that and give these consumers what they need and what they want. Here's Speaking of Women's Health. Here's Empower. They're talking about pelvic health. I mean, I don't want to talk about pelvic health on your hospital main Facebook page where it's not private and it's not focused, and there are all kinds of people there, just gathering information. But boy, give me a group that's focused on pelvic health, then yeah, I might well want to talk about it, or at least a group that's focused on women's health. Fab over 50, lots of over 50 groups. It's amazing how many of these over 50 groups for women are out there. It's a huge market, that's probably why. Healthy Women, Informed and Empowered. And all of these, you can join groups, you can create a profile, you can become part of it, you can write blog posts. One of my points today is that in this world where social media has become so prevalent, all these digital platforms have become so prevalent, the truth about word of mouth advertising has not changed. Word of mouth is still essential, and it is still probably the most effective type of marketing out there. The difference is word of mouth today happens on these platforms. That's word of mouth advertising. And I see my job as a healthcare marketer as creating these environments, whether it's on Facebook or a blog, but creating these environments where people can come and feel safe and feel empowered and want to share information and want to spend time there and also want to take in the information we have to offer about our healthcare facilities. I think that's my job today. I am a builder of online spaces where people can come together and share and learn and become brand ambassadors and become absolutely our best marketers. My friend, Dr. Howard Lux, he's an orthopedic surgeon in Westchester County, New York. He's phenomenal. He's an early adopter of social media, a thought leader among physicians in social media. He says that 17% of his new patients come from social media. Think about that. More than 50% visit his website before the first appointment. And this is his quote. He said, patients who discover me via social media and my website tend to arrive far better prepared and informed. They're also more comfortable with me thanks to watching my videos. All this makes my time with them more productive and more efficient. Howard, through his social media and through his website, is creating exactly the kind of environment, that kind of inviting yet informative environment that I want all of us to be focused on. Patients get to know him, they get to meet him, they get to watch him on video. So I wanted to hit on Facebook, since Facebook is like the low-hanging fruit for everybody. Most people are comfortable with Facebook, both marketers and consumers. So I thought I'd focus quite a bit on how to build community within Facebook. Just what are some of the principles? And for me, it's really simple. It's like hosting a dinner party. And I guarantee you, every one of you knows how to host a dinner party and what principles apply to make it successful. And think about it. Before you even have a dinner party, you think about, okay, who are we going to invite? And when you're making that consideration, you're thinking, okay, what are the commonalities going to be? What are they going to have to talk about? Do they have anything in common? If not, you might not invite them. When you're designing an online community, you think about, okay, who are we talking to? What are people going to talk about? What's the point of having this community? So if you're thinking about, we want to bring bariatric patients online or prospective bariatric surgery patients online to have conversations, and we want to create a community for them, let's just do it on our hospital Facebook page. Well, no, because then you're mixing them with everybody else out there, and they don't want to have a focused conversation about bariatrics on your hospital Facebook page. Create a Facebook page just for the bariatric patients. And I know the pushback I always get on that is, oh, then everybody's going to want a Facebook page. And what's it going to take to administer all those Facebook pages? Well, both of those are valid questions and points. Yes, everybody's going to want a Facebook page, but you have to make the determination, is there a valid reason for having a Facebook page? Is there a commonality there? Is this a group that needs a separate gathering place to come together and tell their stories? If not, it's fine for them to gather on your regular Facebook page. Otherwise, create a Facebook page. If it's women and you're talking about pelvic health, yes, create a separate Facebook page and administer it. And I know that takes time, but frankly, some of the things these marketing departments have been spending their time on are going to have to go away, and we're going to have to spend more time managing communities. And I think the role of community manager or online community manager is going to become more and more prevalent within hospital marketing departments. Today, hardly anybody has them, just a handful. 5 years from now, I think everybody's going to have them, and everybody's going to have more than one. I know in my company, it's becoming the most common role to have community managers here who manage all these online communities, which I include Facebook pages and Twitter feeds and so on. So you figure out who you're going to invite. Then the next thing is you welcome people as they arrive and make introductions. You need to do the same thing in your online communities. So if we're talking about Facebook, people come in, they have the courage to comment. Man, you need to thank them. You need to tell them how much you appreciate them making a comment and try to facilitate conversation. Ask them more questions about themselves. So you have to be gracious and you have to be vigilant. When somebody makes a comment, you can't let a day or two go by before you react. You need to react in the moment as much as possible. And again, this is why you need community managers. You facilitate conversation. You know how this works. And down below, I have you fill awkward silence with new topics. When you're having a dinner party, there are those weird pauses where nobody, the next subject hasn't arisen. So you have to do it. And you say, oh, Jim, you're into antique cars. So is Bob. Talk amongst yourselves. And you get that conversation going. And you know all the people you've invited at the dinner party, so you're able to do that. Well, the same thing happens on online communities. You need to start conversations. And that doesn't mean sending out a post saying we're having a health fair on March 5th. It means talking about things and asking for people's opinions. So you bring up an issue and you say, what do you think? And a lot of people hate doing that in social media. They hate asking questions because they say, oh, well, no one's going to respond. Well, the truth is people aren't comfortable responding. You need to create an environment where they are comfortable. And you need to seed conversations by having people on your team come on and respond to questions, having people come in and post. We have an online community that we just started for a hospital in Massachusetts for parents. And there's a forum as part of that community, and people are shy about commenting. So we're seeding the conversations. We're making comments. And I guarantee you, as soon as people see conversation taking place, they say, okay, this is a safe place for conversation. I'll jump in and participate. But they're always weird about or nervous about being the first one to comment on anything. You also, at the end, need to thank people for coming. So the equivalent of that is thanking them for visiting your page. And then they're gonna, if they're treated right, they're gonna come back and they're gonna leave and say good things about you. And that's what you want. If you respond, they make a comment and you respond, they are being rewarded. That feels really good. They're gonna be more likely to comment again. That's what you want. So we want engagement. Don't think about likes on your Facebook page as engagement. Think of comments and conversation as engagement. And you need to feed that conversation. One of the tools we use is putting videos of clinicians on our Facebook page and making some comment about Dr. Smith, and here's his video. People love that, man. Dr. Smith's patients will go on your Facebook page and they'll start making all kinds of comments about what a great guy he is and how wonderful he is. And we rarely get negative comments. I mean, rarely. This becomes a really positive experience. And it's just a wonderful tool for getting people to talk. This works for nurses too. They love talking about their favorite nurse. So we want to encourage that kind of discussion and sharing. Ask for opinions for people. Ask them to come online and share their photos. Share your photos from the 4th of July weekend or from your most recent ski trip, whatever it might be. And then get some of your staff to start it off by uploading some of their photos first so that they can see that this is actually happening and it's real and it's safe. I already said to respond to comments and questions publicly and quickly. It's most important with negative comments. You don't have to affirm what they're saying and you don't have to agree with them, but you do need to respond publicly and show everybody else in the community that you take this seriously and you're going to research this matter and get back to them offline. That's powerful for the community to see that you handle negative situations really positively and that you're very responsive. It shows that you value the members of the community. And that's what I mean by having a community building mindset. When you have a negative comment, if you have that community building mindset, it really then impacts the way you react. So I love using video to build online community, and certainly I just mentioned in Facebook the physician videos are a great tool. Unfortunately, most hospitals use something like this to profile their physicians. This is from a real Find a Physician page for a hospital, but this is a real OBGYN. I mean, this is the headshot of their OBGYN, black and white. It looks like a prison shot. And this is no way to connect with people, to engage them. Again, think, I want to build community. Man, this is no way to do it. So I want to show you how my company does it. And here's a video of Dr. Michael Dern. He's a primary care doc. So if somebody's looking for a physician, they will meet Michael Dern. And they can decide if they like Michael Dern or not and whether he's the right choice for them. Because at that moment in time, there is no more important choice. So here's Dr. Dern's video.
I'm Michael Dern. I'm a family physician, family doc, I've been at this for about 32 and a half years with Signature Healthcare. What I hope to do is try to take where technology today is bombarding us with the electronic health record, the electronic medical record, and iPods and iPads and this pad and that pad. And by the end of it, all the electronics bombarding us, I'm trying to take what was once our noble profession and help slow down what's starting to become a depersonalized industry. And I love 110 Liberty Street with all my heart. You know, people say, but it's so big. I said, yeah, but it's what happens inside the exam room. And so what happens inside the exam room then translates into, if you need a test, you have it right there. I can go down and look at an EKG with a cardiologist and not have to tell the patient, come back, you know, tomorrow to get the results of your test. And it just makes it so much easier to practice and so much better for our patients to have everything right there in the building. It's not just diagnosing a cancer. It's just not making sure the blood sugar is right. It's more than that, taking care of a patient. And after 32 plus years, some of the patients have been with me my entire career. It is an extended family. So family medicine, family practice, and taking care of the entire family makes for a great day.
So I consider that to be a community building tool. We've done 80 of these videos, I believe, for physicians at Signature Healthcare. And it's just such a powerful tool. And the physicians, you know, didn't believe in this effort when we first started it, and now they are truly believers, and they know we're trying to market their practices and build their patient panels. And the patients love being able to go online and see these videos and really meet the physician before the first appointment. It's even more powerful with a pediatrician when a mom or dad is bringing their child in for the first time and they've never met this particular pediatrician or pediatric specialist, and they can meet them online and become familiar with them. I just think it's a really important tool. We're nearing the end, but I wanted to hit upon Twitter. I love Twitter for building community. The same principles apply as they do to Facebook. We schedule tweets for the week, which are just those basic, boring, spewing tweets, you know, that content that you're spewing out there. But then every day we are in there engaging. So we don't have to worry about, have we had our tweet today? We've got tweets scheduled for the week about the stuff we have to talk about. There's an open house at this practice, there's a health fair going on, whatever it might be. But then our time and energy during the week is spent talking about things that are important to people, interacting with people, retweeting stuff, thanking people. And I will tell you, hashtags, I think, are the key. Because one of the commonalities you're going to find, if you're, say you're a community hospital, one of the commonalities you have is a geographical one. People identify with their region. And I'm amazed at how many people are tweeting in their areas and they aren't using hashtags that help sort the data by geography. So if you're tweeting in Boston, you ought to be using a Boston hashtag. Or, you know, we have a client in Stowe, Vermont. Well, you ought to be using the Stowe hashtag or a Vermont hashtag if you want to get a little broader. And then if you're talking about health issues, use hashtags that define what the health issue is that you're talking about, whether it's diabetes or weight loss or breast cancer, whatever. The hashtag is the way you find community on Twitter. And it's just so important. And be a resource. You know, sharing links, I think, is so important on Twitter. And it always frustrates me when people do a really great tweet, but then there's no link for me to get more information or to find that source of information. So provide links. And again, as I mentioned earlier, don't make it all about you. You know, 65% of the information ought to be about other things, and 35% ought to be your stuff that you're spewing out there as information about your hospital or health system. Approach Twitter just like Facebook with a spirit of generosity. You're sharing, you're engaging. It's not about what you generate, it's what you share and what you retweet. It's how you thank people and acknowledge people. There's really such a civility to Twitter. You should be thanking people for sharing information and for retweeting your information. And if you aren't taking the time to do that, then you are just that old school pusher of content, and that's no good. I wouldn't want to follow you if that's who you become. It's about reciprocating, and it's about being kind and thoughtful. And I love, if you want to build community and you're thinking about a specific health condition, think about a Twitter chat. I'm a part of several Twitter chats each week. One of my favorites is the healthcare leaders, which is on this screen right now. The hashtag is HCLDR. It's every Tuesday night at 8:30 Eastern time. This was from last night's Twitter chat. These were the stats from that particular chat. We had 13 million impressions over that hour. There were over 2,000 tweets, 196 participants. It's a phenomenal experience, but there's a breast cancer social media Twitter chat that's just phenomenal. There's almost every health issue you can think of. There's a Twitter chat that deals with it. Either weekly or bi-weekly, or sometimes they're monthly. But it's a great way to pull people together. It takes time to build a following, but they will find you. And if you haven't ever done a Twitter chat, it's probably hard to even fathom, but it is a community. This healthcare leaders group that I'm a part of, it is a community. I love it when I have time to make the Twitter chat on Tuesday nights. It's like reuniting with all my old friends. And we spend 10 minutes at the beginning just welcoming each other and saying hello. And again, following all those rules that I've outlined for community building. And then usually the chat, after it officially ends, people keep talking till midnight, just off on the side. And you don't have to do that, but they just get so caught up in the conversation. There's a topic each night, and we have 3 questions that we deal with. I love blogs for community building as well. I've mentioned that before. I just want to point out some doctor blogs, because it's just amazing how some of these doctors are really leading the way. Dr. Natasha, she's a pediatrician, very famous and very active in social media. Russell Faust is a friend of mine. He has his site is the Booger Doctor. I think his kids actually branded him the Booger Doctor. Wendy Sue Swanson is probably the most famous of all these physician bloggers, and she's Seattle Mama Doc, and she's phenomenal. Dr. Howard Lux, I've already mentioned. He's an orthopedic surgeon. But here's Dr. Natasha's blog, KC Kids Doc, Contemporary Paradigm. And it's just incredible information. And what each of these doctors, here's the Booger Doctor, Russell Faust, each of these doctors find that by having blogs, their patients come in better informed, they're up to speed on things, they can pass by a lot of the stuff that they would normally have to deal with because their patients are following them, they're reading, they want to know what their doctor's talking about. It's really amazing. Seattle Mama Doc, I definitely recommend checking out her site. She likes to use video, so she does video posts periodically. And then Howard's got a great blog. He loves using video. He'll just shoot video off of his webcam and post it as a blog post. And he has no problem with doing that. He's very straightforward. He spends more time trying to talk people out of orthopedic surgery than talking them into it. He's a great doctor, and he's really learned to use social media and video and the web to engage patients. And then we create a lot of online communities for moms, for families, and they all serve hospital sponsors. This is one, the Signature Moms blog for Signature Healthcare and Tufts Medical Center and their children's hospital. It's called Floating Hospital for Children. And this blog, we brought in 8 community bloggers through a Facebook contest. We recruited them. And then we worked with them on building a community, and it's amazing to see it happen. The bloggers are the original community, and then the readers start to come in and join, and you can see how it's grown. Like in year 1, we had 42,000 visits, then year 2, 64,000. This year we had 93,000 visits. We've had over 230,000 total, and the coolest thing is we have 2,700 subscribers. Those are people who have opted in to get an email every time a new blog post goes up on the blog. That is huge. That's a sign of community. These people have joined. That's wonderful. Check out the Signature Moms blog. It's signaturemoms.com. Very easy. And then online patient communities. We've talked about these with Patients Like Me and Inspire.com. Here's Patients Like Me. Go and join, just so you can look at the communities and look at the conversations that these patients are having. And then Diabetic Connect, there's tons of diabetes communities. Here's one we've created for a client that this actually looks just like their website. It fits within their website. It's called Care to Share. And we solicit patient stories. We go out and gather patient stories and tell their stories here on this site, either through video or through written narrative from the patient. But it's a great way to share patient stories, and patients want to tell their stories. And for somebody who's thinking about having surgery or having some procedure at the hospital, they can hear from actual patients and learn about what's happened there at the hospital. Here's a little form where they can submit their story, or they can simply email us and we'll call them and gather their story. But it's a neat project. And finally, your website as an environment where you can create community. This is Howard Luck's website. This is when you land on his website. This is an orthopedic surgeon. Look at that video right there. You meet him face to face. It's not a lot of text. It's real. When you watch that video, it is real. You'll know that is Howard. And you can either like Howard or not like Howard, but that's the real Howard. And you can make a decision about, is this someone I want to have as my orthopedic surgeon? Well, we can do the same kind of thing with our hospital websites. We can integrate video into them with no problem. I think this is Dr. Natasha's pediatric practice, actually, but I love this website because when you go to the doctor profile, you click on, this is Julie's profile. When you click on Julie's profile, here it is. It's written in normal language. I'm married to Chris, for more than 20 years, and together we have 3 kids. Very normal language. It's not bullet points from a CV. And then down at the bottom, there's an arrow to play the video, so you can get the video and meet Julie face to face through video. It's very friendly. It's inviting. We can all do this with our websites. There's no reason not to in this day and age. And look at this, El Camino Hospital in the Silicon Valley. Not only do they have Nurse Barb's video here where you can listen because she's a pelvic health nurse, but you can email her, you can have a live chat, or you can call, and you can click and read her blog. That's engagement. That's changing a website from just the static thing where we're spewing content to something where we're inviting people to be in a relationship. And that is huge. And this isn't pretty. It's not fancy. But man, they are doing things right. This is what we all ought to be doing. I was so impressed when I found this. I was working on a pelvic health presentation and found this site. I was thrilled. So my last slide. In building communities of shared interest, it's all about finding those commonalities, and it's about being civil and creating welcoming environments. And you all know how to do that. Encourage people to tell their stories and interact with each other. Feed their interest with good information. There's nothing wrong with giving them good information, but that can't be all that you do. Position your organization as a resource with a shared passion for the subject, absolutely, and let those people become your best marketers. So there's my contact information. I'm going to turn it over to Dan so he can continue to moderate, and if there are any questions, we'll be glad to answer any questions.
That was a great presentation. I enjoyed that so much. So many really powerful takeaways. We do have a few questions for you here. We've got just a few more minutes. All right. The question is, what platforms would you recommend we start with as we begin to build community?
Great question. I think the number one sin in online community building is trying to do too much with the resources that you have. My preference is always that you focus and you do a really great job on what you're focused on rather than be fragmented and be trying to do 10 different things and do them all kind of halfway. So I recommend focusing. Pick something that's going to work. And I think some of it's going to be determined by your audience. What are you going to have the most success with in terms of the audience that you're trying to reach? One of the benefits of Facebook, and I'm not a Facebook advocate. I'd like you to build private online communities that don't involve Facebook. But one of the benefits of Facebook is people are comfortable with it. It's a known quantity. You know, people aren't scared of Facebook, although they probably should be because of privacy issues. But people aren't scared of it. They're comfortable with it. They know how to use it. Almost everybody has a Facebook account. So Facebook is often the low-hanging fruit. I think you have to really think about it. I have a client right now that we're working on a Twitter chat, and I really think a Twitter chat is the way to go for this particular health issue. And it's going to position this particular healthcare provider as the authority in that particular area because there isn't a Twitter chat right now on that particular subject. So they're going to be the forerunner, and they're going to own not that hashtag, and they're going to own that subject matter, and they're going to be the ones providing the resources and facilitating the conversation. So I think it's really dependent on the situation and the resources you have. But the most important thing I could tell you is don't overreach. Only take on what you can handle right now. Dan, what would you say to that? I'm curious how you might answer that.
Well, I think that's a really great answer, Dan, actually. And whatever platform that you use needs to align with your strategic objectives and your goals for your marketing strategy. So that's the big picture look, is who am I trying to reach and what is the most effective way to reach them? I loved your comments about how the most successful communities are the communities that focus on natural communities. So not all hospital patients. That's not your ideal community. Your ideal community is all moms, or all new moms, or all women, over 55 or whatever. And you did a great job of segmenting those markets. But identify where your real target market is, and then find the tool that reaches those people the best. That's where to start.
And Dan, I know I said it during the webinar, but one of the things that I think is so important is people have this misconception that if you build an online community, patients or people will show up. And that's just not the case. And for instance, the one we're doing in Massachusetts right now, we're marketing it through a lot of traditional marketing tools. We're doing all kinds of things. We're doing table tents in the cafeteria at the hospital, so people within the hospital, both patients and family members and employees, will know about it. We're doing these static cling posters all over the hospital. We're doing digital advertising, because you can be so targeted with digital marketing. So we're doing digital marketing to reach the potential audience and drive people to the new online community. Beyond managing the community and being very vigilant there, you need to market the community when you first build it, even if it's that kind of natural affinity group, Dan, that you were just speaking of. You still have to let people know it's there, and you have to reach out to them to build that critical mass to make it a success.
I really love that point. You use these traditional tools often to drive people to the new communities that you're building, which are way more interactive, right? Wow, it looks like we're approaching an hour here. Shall we ask one more question?
Sure, and if people want to go, we understand. That's fine.
Okay. All right, so this is a question about, we've got some platforms, some social media platforms, but they're not growing as we'd like. What could we do to start building more momentum and create more interest?
Wow, that's interesting. What I would want to do is look at those platforms and think about what are you doing now, and then think about this whole concept of community building and what could you be doing differently. What are you doing to interest people? Think about that consumer who has that "so what" stamped on their forehead. What are we missing? What do people want to hear about? I think on Facebook, a really simple thing is to ask people what they'd like to learn more about. With social media, one of the things I've found is we're so inwardly focused as healthcare organizations. It's all about us, and it shouldn't be all about us. It should be all about the people we're trying to engage. So what are they interested in? How do we get them talking? It can start with your employees. Get your employees talking. I remember we started a blog for Lexington Medical Center probably 6 or 7 years ago, and we thought we were creating a tool for communicating with the masses at that time. And what we found was we were getting all this traffic. I mean, we were getting 2,000 hits a week, and we thought, wow, this is amazing. But when we went in and looked at the analytics, the majority of that traffic was coming from within the hospital. Those were people, employees of the health system, who were interested in learning what was going on. They have a great corporate culture there, and people are very interested in what the organization is doing, so it made sense. But what we found was that blog became our best internal communications tool. So you need to think about the audience and what they want to hear, what they're interested in. And you might not be focused enough. You might not be talking about the right things. But it's tough without looking at it. I look at hospital Facebook pages all the time, and literally it is post after post after post about something going on at the hospital, and there are no comments, and there are a few likes, and people feel great about the likes. But I mean, come on. I don't know how you guys use social media, but when I get up in the morning, I look at Facebook and I go, like, as I go down the page. And that's just me acknowledging my friends and clients and so on and giving them support. But that's not me being engaged. I can do 50 likes in about a minute and a half. So don't be fooled by those likes and look at your Facebook page objectively. I mean, I remember I was looking at Mayo Clinic's Facebook page years ago when Facebook pages were laid out differently. Now, if someone visits your page and makes comments, it's kind of off to the side if they make their own separate posts on your wall. But back then, they were just embedded in what looks like a news feed or on your wall. And there were like 90 posts from patients and family members before I found one post from Mayo Clinic. That's an example of engagement. That's building online community. Mayo Clinic wasn't having to do anything. They were just letting the conversation flow. And sometimes you got to have contests, get people interested, have them post photos. When we do our mommy blog contest where we recruit bloggers online, it's amazing the conversations that take place. We have the moms or potential bloggers post on the Facebook page and tell us why they think they would be a great blogger. And once they do that, all of their friends start coming on the page and saying, oh, I love Mary. She's great. You ought to select her. And all of a sudden, this page takes on a life of its own. And then the people who are striving to be bloggers, they start talking to each other. And before you know it, they're exchanging recipes and talking about their favorite pin boards on Pinterest. So it takes some work and it takes some ingenuity and creativity. But the first thing is to look at the site and look at how barren it is and what aren't you doing.
What a great answer. Thank you for that, Dan. And thank you for all these really specific ideas today and the practical applications that you shared with us. We're going to wrap up now, but before we let everyone go, we want to make sure you're aware of our next webinar. So on March 11th, I'll be presenting People-to-People Healthcare, how online communities can help you engage patients and actually improve their health. And so save the date, watch your emails. In a few weeks, you'll get an invitation for that webinar. Thank you, Dan, for your presentation. Thanks all of you for joining in today.